Happy Tuesday, everybody, and welcome back to another episode of 10 a.m. Tea with Natalie. It is 10 a.m. Pacific, 1 p.m. Eastern, and I am back with you guys to start talking about acupuncture. And this looks a little fuzzles. There, that's a lot better. I put the phone on my face. I get a little schmooshy sometimes, y'all. It happens. So I hope that your week is off to a wonderful start. I think that bringing awareness to what exactly acupuncture is and how it can help people is really important. I feel like there's a big gap between people knowing that acupuncture is like needles, but not knowing exactly what to do with it or why you would use it or how it helps you. So I think spending a significant amount of time in the coming weeks kind of going over exactly how acupuncture works, where it came from, and why you use it is going to be really helpful for everybody. So I am an acupuncturist. And acupuncture means, so this is what I tell patients when I'm doing my PARQ conference, when I'm, explaining the risks and benefits. Acupuncture is the insertion of stainless steel needles at specific areas on the body called acupuncture points, okay? And the needles are puncturing acupuncture points. That is acupuncture. But acupuncturists are actually using what's called Chinese medicine. Chinese medicine is the framework in which acupuncturists work. That is our understanding of health and well-being and how to restore health and well-being in the body is based on Chinese medicine, which is actually rooted in Chinese philosophy. But we're going to get into that a little bit later. Acupuncturists are also classified as CAM providers, C-A-M. And what does CAM mean? Complementary Alternative Medicine. And so this is kind of separating it from the standard Western medicine. And so Western medicine is known as standard care, where you're getting your care from your MDs or your DOs. It's also known as orthodox medicine, allopathic medicine, regular medicine, conventional medicine, mainstream medicine. These are kind of the words that we use to describe Western medicine overall. And so if you are not Western medicine, then you are something else, which is the complementary alternative medicine piece. Complementary alternative medicine includes massage also. Good morning, Scott. Thanks for checking in. Acupuncture, dietary therapy, breathing techniques, guided imagery, self-cultivation stuff like Tai Chi and Qigong and yoga, chiropractic, meditation. These are all the things that are kind of lumped under complementary alternative medicine. And complementary alternative medicine also means kind of different things. The complementary means that you are using these other techniques in addition with standard care. Alternative means that you are not using Western medicine at all and you are only using these other kind of modalities. So it is, in America, it is quite unusual for a person to not have a primary care physician and to only be seeking kind of alternative or complementary care from non-standard medicine. There are a couple states where complementary medicine providers can be primary care. So California would be one of those states where your acupuncturist can be kind of the whole show for you. But in most states, that is not the case. Especially in Oregon, I am not considered to be primary care. So my patients would also need to have a primary care physician, a standard physician, an MD or a DO looking after their case as well. So that kind of explains the difference between Western and Eastern to kind of get a little bit of terminology down. There's also another piece called integrated care, which is kind of similar to complementary in that you are using acupuncture, massage, meditation, and your standard care together at the same time, integrated to achieve the health and wellness results that you're looking for. So that's kind of a dip of a toe into what exactly is acupuncture. So first we have to kind of define it in regards to that it is not Western medicine. And then we will get more and more into the nitty-gritty as we move forward through the week. So I hope that you found that to be interesting. If you haven't yet, make sure that you sign up for the weekly newsletter. Starting again on Monday, I'm going to be sending them out with a weekly summary of all the things that we talked about this weekend, 10 a.m. tea. So if you haven't yet, make sure you click the newsletter sign up button on the left-hand side of the biz page here. Get your information in, and I will make sure to get that into your inbox Monday morning. Also, make sure that you're taking good care of yourself today. Have a glass of water. It's 80 in Portland today, so make sure that you're staying well hydrated, doing all those things to take care of your body so your body can take care of you. And I will check back in with you again tomorrow at 10 a.m. Pacific, 1 p.m. Eastern, 10 a.m. tea with Natalie here on Facebook Live. See you soon.